is going to be somewhere in the middle,
Ben,
rather than at the extremes of that
set of technical
band.
difficulty then.
But it is just too early. The best estimate I can give you really is that the data will begin to firm up sometime next week. And I think next week will be the first time when we have a ranging shot
massive technical issue at this end.
Transmissibility increase is. And that will then feed into models that will help us understand how this looks in terms of the future prospects, in terms of resurgent disease, and from there ministers will be able to make further decisions. But what I can say in the meantime is that I pitch this personally as a straight race between the transmissibility of this new variant. That transmission is not inevitable. People can slow it down through cautious behaviour. They can slow it down through using test, trace and isolate, and that cautious behaviour is very important where we know there are hotspots. So on the one side the race is transmissibility, the other competitor in the race is vaccine delivery, and the NHS is doing everything it can to turbo boost that, and that is the challenge that's ahead of us in the next 2 to 3 to 4 weeks, to make sure that we outrun the virus through really vigorous pull through on vaccine delivery. And that is why when you are called you must come forwards and help us finish the job.
Thanks very much, Hugh. Next question is from Emily Morgan at ITV. Emily.
Thank you very much. You're hoping to stop the spread of the variant with vaccinations and surge testing, but it is still spreading. So it appears that surge testing isn't actually working, with millions of people still not vaccinated. Aren't you afraid that this will inevitably lead to more hospitalisations and deaths?
Well, not necessarily is the answer. And that's why we've taken the approach that we have, because we saw surge testing work effectively in reducing the spread of the South African variant in South London. And if you remember, we discussed this about a month ago. We put in a huge amount of testing. About 250,000 tests were taken in South London in a very short space of time, and that did manage to stop the spread of that variant. And I'll ask Jenny Harries to explain the details of what we're doing, not just now in Bolton and Blackburn, but more broadly where there are hotspots. But we have seen this playbook
What's
work,
a hotspot not?
and we want to do that.
I don't know. They just showed
the advantage we have now compared to, say, in the autumn when the Kent variant first arrived, is we just know so much more about it so much faster because of this extraordinary surveillance capability. So we could spot the rise in cases very, very early, and it means that we can act in this way without having to take more drastic action, given that the overall picture when you take the nation as a whole is really quite positive.
Right.
Thank you, Secretary. So yes, so I think the original question was around vaccination. I would just like to highlight the point that's been made in the really fast moving of this turbocharging to the vaccination programme. So just in Bolton alone, last weekend, 6,000 people were vaccinated. For a small area, I think this is down to the really hard work of our NHS colleagues, local authority, Directors of Public Health, everybody working together to ensure people come forward for their second dose if they haven't had their first one, to do that. But in terms of what we're doing, as the Secretary of State has said, we are in a completely different place to where we were last year. Our genomics testing is probably the best in the world. We're donating 30 to 40% of GISAID tests, so we're showing the world what we're doing and actually giving other countries information about the variants which are arising. And with that very precise testing, we can follow backwards, follow up chains of transmission, undertake very enhanced contact tracing, so people are going using shoe leather to going door to door, working in these areas to support individuals, increase the testing capacity. So,
It's
for
just
example,
not working
bringing
today, is
testing into schools again, so that we're sure that people are able to do the test properly and support them to do that. And then supporting individuals with isolation. So there are flexibilities about financial support in many areas to allow people who might otherwise be worried about being able to afford to isolate to be able to stay out of circulation and therefore decrease the transmission risk. So I think although there are a lot of cases, we actually have evidence. So Sefton, for example, has done a brilliant job recently with the rise in cases of this variant, and actually that has now plateaued and is starting to come down again. So it is not a game lost at all. It's very much one to fight, and there are huge resources and huge amounts of effort, particularly from the public, in all of these areas, and we should continue to do that.
I mean, I just add, reflecting on Dr. Harry's answer and your question, I just add one thing, which is, this is on all of us again. We are masters of our fate. By taking the tests in one of these areas, by coming forward and getting vaccinated, by behaving with caution, and we all know the things that we need to do, especially outside is safer than inside, and wearing masks, we can get this under control. But again, it is something for us to do as a community, and in particular in the areas where we're seeing the faster rise. JVT.
I just want to add and pick up on your comment that we're hoping to stop the spread with vaccines. Yes, of course we are, but on their own, they will need support from people being cautious and from the test, trace and isolate. I've said it many times at this podium, and I've said it to probably countless patients that I vaccinated with the first dose. Please remember it's going to take probably around 21 days for you to have some protection from your first dose of vaccine. Now, thankfully, with the second dose, we would expect that enhanced protection from the second dose to kick in much quicker, but still with a delay, and probably 7 to 10 days delay. And that helps explain why it's so important now that we push on and get as many second doses into people as possible.
Thanks very much indeed. Next question is from Kathy Newman at Channel 4. Kathy.
Channel 4.
Secretary of State, you spoke about standing side by side with other nations in the world, but tonight we're reporting on the Treasury's insistence that any COVID-related help that your department gives to countries like India has to come out of the UK government's overall international aid budget. Would you like the Chancellor to reconsider that?
Well, of course we're helping other countries around the world, including India, and of course it counts as overseas development aid because it is. But what I'm really pleased about is that we've been able to support India so much already. We were the first country to put in support, and I've been talking to my Indian opposite number. We've engaged on what they need. We've engaged, for instance, on an offer of PPE, but they have not asked for PPE. What they have asked for is support with oxygen, and so we've sent in oxygen concentrators and machines that generate oxygen to be able to support their hospitals, and we've been able to do that within our aid budget and working with our colleagues right across the UK. So we've been able to deliver support for India. But as I said in my opening remarks, the biggest thing that the UK has done for the whole world, including India, is by developing and deploying the Oxford AstraZeneca vaccine at cost. It means that effectively we have supported the vaccination of over 400 million people, including over 170 million people in India. And so we can be very proud of the part that we've played in tackling this around the world. Harry Cole at The Sun.
Budget, aren't you risking other international aid?
Sorry? Harry, was that you?
I'm sorry, I was just asking a quick follow-up, if I may.
Yeah, go ahead.
Think of oxygen generators out of the overall aid budget. Aren't you then risking cuts to other international aid projects?
Oh no, we have a very generous aid budget overall, 0.5% of our GDP. And I think this is exactly the sort of thing that we should be deploying in terms of aid, helping other countries around the world. But obviously it is aid. I mean, that's just by
Yeah, but the India have also
definition.
got
You
a
send
space
aid to
race
another
and a
country,
nuclear
it
thing
counts
going
within
on.
the Overseas Development Assistance
So
budget. As
help
it's
them in the
technically
crisis, but
called. Thanks.
I'm sure they can help
Harry.
themselves.
Thank you, Secretary of State. Earlier in the week, ministers said that we could go to amber list countries to visit friends. But today, the Prime Minister says we need an extreme reason to go to an amber list country. Can you give us an example or two, if possible, of what an extreme reason would be? And is it of regret to you that these mixed messages have once again dominated a week? And are you going to apologise to holidaymakers who once again find themselves facing a summer of chaos when the list could have been explained a little bit better, frankly? And a question for whoever can answer it, really, whoever's best qualified to answer it. The Secretary of State mentioned that there are 25 COVID patients now in Bolton Hospital. By my maths, that's up 6 from 19 last week. Is that rate of increase a cause for concern, or is it actually better than feared?
Thanks very much. I'll ask Dr. Harris to answer the second question. On the first question, we've been absolutely straightforward about this, and the thing is, I think that the public get it and understand. If you look at what the Prime Minister said last week, what I said at the weekend, what I said in the House on Monday, what the Prime Minister said at lunchtime today, we've been absolutely crystal clear that you should not go to an amber or red list country on holiday. You should only go in exceptional circumstances. You asked for examples. An example might be to visit a very ill family member, or to go to a funeral of somebody who is very close to you. They're two reasonable examples. And I think we have been really clear through this pandemic that there are some things that we have banned in law, but there are some things that we do not recommend. But you don't necessarily have to ban everything. That as a government minister, if you don't advise it and you think that it isn't the right thing to do, you don't necessarily ban it. There are many examples of that. But what we do know
if you go
is
abroad
that the public have
in
been
an
brilliant
international
at
pandemic,
exercising the personal
then
responsibility
you must
that we
have
are seeking.
You must
And
be aware
so
that you
I
may not
would
be able to get back.
advise all Sun readers
Things
to
change.
listen to the Prime Minister, to follow the government advice which is on the government website, to book a holiday if you want a holiday abroad. That's what the green list is for. Or, like me, to holiday at home. Jenny.
Thank you. So on the second question about hospital numbers, obviously it's not just Bolton, it's every area where we're seeing variants across the country. We're looking continuously to see if we are getting increased hospital admissions and if there are any fatalities for that, sadly, associated with it. And as Professor Van Tam has said earlier, actually we are not seeing that at the moment, and the change in numbers that you've described is really too small. We're seeing a fairly flat level of admissions. We have cases and we expect people to come in and out of hospital. We're not seeing sharp rises at the moment, but clearly we will continue to monitor that. The only other thing I would just add as well is, in interpreting some of these numbers, we have continued to learn right through the pandemic, and the NHS now offers pulse oximetry out to patients. So we might find that patients are in the community more than they're in hospital or vice versa. So I think we need to take an overall consideration, which is what we do on a very regular basis.
Thanks very much. Any follow-ups, Harry? I can see you.
Yes, please. With all due respect, Secretary of State, you haven't been crystal clear, have you? Because on Monday, George Eustice was saying that it was okay to visit friends in amber list countries. He was wrong, wasn't he? That the example you've given isn't to visit friends; it's to visit very sick relatives. Why are these mixed messages?
Well, I thought this subject might come up, so I took the trouble to look at what we said when we announced the travel policy ahead of the 17th of May, what the Transport Secretary said, to look at what the Prime Minister said last week, to look at what I said at the weekend, to check the record of what I said in the House on Monday, to look at what the Prime Minister said at lunchtime today, in case this question came up. And you'll be glad to know that all of those statements were completely consistent and consistent with the advice on the gov.uk website. And that is that if you go to an amber list country, when you come back, you have to go through the testing regime with 3 tests. You have to quarantine. And I can tell you that we have, in the last week, done 30,000 home visits to check that people are quarantining. And you should only go to a red list country or an amber list country if you have exceptional circumstances. The purpose of the green list is that we've looked around the world at the countries where we think that it is safe to travel, both from a point of view of having no or very, very low variants of concern and a low case rate, just as we have here in the UK. That green list is there for people who want to have, foreign travel and, for instance, for a holiday. The amber list is not for holidays, and the red list is not for holidays either. That's the policy. We've been very clear and consistent in terms of the language that the Prime Minister and the Transport Secretary and I used,
understood all that,
and it's all been on the gov.uk website. And I'm sure that Sun readers have got that from the start, because we've also seen actually we've seen the public get it, and many members of the public I know are looking forward to an extremely good holiday in the UK this summer. Thanks, Harry. Next question is from Heather Stewart at The Guardian.
They're getting a lot of airtime today, aren't they?
Hello, Secretary of State. The Indian variant appears to have been able to take hold and spread rapidly, despite 2/3 of adults having received at least one dose of the vaccine. Given the concerns about other variants emerging, would it be prudent to wait until all adults have at least some protection before removing what you called the shield of restrictions, such as masks and distancing rules, rather than sticking to the 21st of June date in the roadmap? And just for Professor Van Tam, you talked about cautious behaviour being very important in those new hotspots, Leicester and Bedford and so on. I wonder whether you'd advise people against taking advantage of some of the new freedoms that have been allowed this week, such as meeting up in pubs and restaurants. And would it be unwise for people from outside to travel to these areas to visit family and friends?
Thanks very much, Heather. Two excellent questions. I will. All I'll say before handing over to Professor Van Tam on the roadmap is, we'll set out a decision on the 14th of June, looking at all this data. We are seeing the vast majority of cases, both of the existing variant and of the B.1.617.2 variant, amongst younger groups and unvaccinated people. On the one hand, that is actually a good sign, because it implies that the vaccine is working effectively. But obviously, we don't want to see a huge increase in the number of cases anywhere. We have said all along that we expect some increase in cases, and of course, younger people who are much more likely to be those yet to be vaccinated are much less affected in terms of hospitalisations and deaths. And that core fact about this virus underpins the strategy and the roadmap that we've set out. JVT.
Yes, thanks very much for the question. Look, the areas that have been mentioned today in the press briefing, including Bolton, are absolutely areas of concern for now. And I would advise the residents in those areas to think very carefully about the freedoms they have, weigh up the risks, and be very cautious. So, if it is possible to do something outside, better to do it outside. If it is possible to do something with smaller numbers, with people
if
you
you're
know
an
rather
influencer,
than
you can go
multiple
to red
new
and amber
contacts,
country. Yeah.
it's better to do that.
I'll book my
Take
plane
it
to
steady.
Dubai.
I think I've said don't tear the pants out of it once before from this or a similar podium. But frankly, we're back to that again now. The government has given people freedoms to start to make these judgments for themselves. And I understand that, we can't live for years and years on end with rules. People will have to learn to manage these risks from COVID for themselves, because this is not going to go away in the short term, the medium term, and probably the long term. But you have to be cautious. You have to weigh it up really carefully. And if you don't feel well, you need to absolutely get a test. If you're offered a test as part of the surge testing, you need to have it. You need to follow the rules on isolation. And when you get the call for the vaccine, whether it's your first dose or your second, remember this is a race against the transmissibility of the virus. Don't delay, take up the offer, come forwards immediately.
Thanks very much indeed. Is that okay, Heather?
Yeah, she's all right.
Very good. Final question is from Andy Woodcock at The Independent. Andy.
Oh, Andy.
Secretary of State, the European Council has decided today that it's going to recommend that anyone who has been fully and properly vaccinated can come to the EU this summer. There'll be a lot of people in the UK who've had their 2 jabs. They'll think, I've been vaccinated, I'm safe, I can now travel to the EU, I can go to France or Spain, but I can't come back, because if I do, then I'll have to go into quarantine as things stand. Why is it that people who've been properly vaccinated aren't exempted from the traffic light system? And if I could ask the medical experts, if somebody has been fully vaccinated, what sort of risk do they actually present to people if they go abroad? Is the decision by the European Union to allow vaccinated people in a rational decision to take at this stage?
Thanks very much, Andy. Well, the thing is that most areas of Europe, most countries in Europe have a higher rate of the virus than we do, some significantly. And there is also a much more significant presence of the so-called South African variant of concern in mainland Europe. And that's why we've chosen to put only Portugal out of mainland Europe on the green list. And for instance, on the latest data, the proportion of the South African variant in France was around 5%, and hence we've kept it on the amber list. We take these decisions in order to protect the recovery at home. And so, of course, it's a matter for the EU, what their international travel rules are, and largely it's a matter for individual countries within the EU. I've seen the proposals. It's not a final decision, I understand. I've seen the proposals from the EU, and obviously I talk to my EU counterparts all of the time. So we will work with them. In the long term, we need to find a way to have safe international travel. But right now, with our levels of vaccination really good, but not yet there, we are, I think, wise to take a cautious approach to international travel. Anything to add?
Yes, thanks for the question. It is a good question. Vaccine effectiveness is not 100%. We know that from the clinical trials. And we know that vaccine protection is going to vary by individuals. It's probably going to vary by age. There are some data that suggest that protection is not quite as good in people who have a suppressed immune system, and it is possible that we will see some signals in the future that vaccines don't work quite as well in people who have a range of chronic illnesses. So in other words, it's very personalised how well the vaccine is going to work for you personally. On top of that, we can't solve this by just measuring your antibodies, because T-cell immunity is far less measurable and is much more difficult to do, and that's another component of the degree of protection you're going to get. And then I think we can be very clear that when or if a vaccine fails to give you the maximum amount of protection that you were hoping for, and what it says on the tin as it were, then the things that are going to go first are the vaccine's ability to protect you from infection and to stop you from transmitting it to others. The things that will go last are the vaccine's ability to stop you getting into hospital, having severe disease and dying. They're the bits that we think, are generally the strongest, even with a weaker vaccine. So from that perspective, the bit that fails first if a vaccine's not 100% is its ability to stop you getting infection and transmitting to others, even if it would still keep you out of hospital and stop you from dying of COVID. So that's a tricky nuance in terms of the argument that just because you've had vaccines, it's entirely safe to go abroad. Everything is relative. And the other bit of relativity is whether you're, when you go abroad, jumping into a pond with one shark in it or jumping into a pond with 100 sharks in it. It changes the likelihood that you're going to get bitten. And the disease levels in these different countries,
Analogies
potential destinations, are all very different. And as we've just laid out, some of them still have quite high levels of disease activity compared to the UK. So I think it's a fair ambition, I think it's a good aspiration, but I think we have to move very cautiously and find our way forwards carefully on this.
Well, there you are, Professor Van Tam's theory of relativity. Anything to add, Dr. Harris?
Just to say that the variant that we're looking at now, the B1617.2, we think has been detected in 48 countries to date, 44 of those confirmed on GISAID, which is the international library, if you like. And it just goes to show how many different variants are out there. And we've just had a conversation about understanding the vaccine effectiveness against that variant and waiting for the information. So I think we still have a lot to learn. But as Professor Van Tam said, a good aspiration and ambition.
Concludes today's coronavirus briefing from here in Downing Street. Thank you.
Crikey. He normally gives us a little speech